Assalamu alaikum, respected chairpersons, honorable judges, faculty members, and fellow participants. My name is Azka Fatima, and I am here presenting my research work entitled Nanoparticles of Quercetin Gum Conjugate for the Controlled Delivery of Fluconazole. We know fluconazole is a commonly used antifungal drug for the treatment of Candida albicans infection. However, the conventional therapy has certain limitations, such as drug resistance, rapid release, reduced bioavailability, and the need for repeated dosing. To overcome these challenges, we developed a nanoparticle based oral delivery system using quercetin gum conjugate. Aims and objectives. The primary objective of this study was to develop a quercetin gum nanoparticulate system loaded with fluconazole to enhance the delivery of fluconazoles. Specifically, the study aimed to achieve controlled drug release, improve its mucous DNA permeation, evaluate its safety and antifungal efficacy, and enhance bioavailability compared with the conventional fluconazole suspension. Methodology and characterization. This slide summarizes the methodology adopted in this study. Initially, the quercetin gum conjugate was synthesized, followed by the preparation of fluconazole-loaded nanoparticles. Formulation was then characterized using different analytical techniques such as an NMR spectroscopy, FTIR spectroscopy, XRD diffraction, XRD, differential scanning calorimetry, thermogravimetric analysis, zeta sizer and zeta potential, and scanning electron microscopy. In addition, in vitro drug release, cell viability, antifungal activity, microDNA permeation, and pharmacokinetic studies were also performed to evaluate its therapeutic potential. Result and discussion. This figure represents the overall preparation process. First, the gum was chemically modified with quercetin using EDAC and NHS as the chelating agent. The conjugate called quercetin gum conjugate GQC was formulated, which is then cross-linked with STPP, and nanoparticles were formulated using high shear homogenization and centrifugation. This slide shows the in vitro release behavior of pure fluconazole and fluconazole-loaded nanoparticles in different media, including STF, SIF, and PBS, which simulates physiological conditions. Pure fluconazole exhibited rapid release in all the media, as shown in Figure 2A. However, the nanoparticles formulation showed a slow and sustained release profile, as shown in Figure B, C, and D, indicating the potential of the system for prolonged antifungal action and reduced dosing frequency. The successful conjugation between the quercetin and gum was confirmed using HNMR study. When two compounds react, proton signal shift and new peaks appear in the NMR spectra. Comparison of gum and quercetin gum spectra proves that the modified conjugate was successfully performed. These slides present the FTIR and XRD analysis for the structural characterization of the formulation. FTIR spectroscopy was employed to identify the functional group and evaluate drug excipient compatibility through the analysis of molecular interaction. The FTIR peak shifts indicating intermolecular interactions among fluconazole, quercetin, and gum, thereby confirming successful drug incorporation and conjugate formation as shown in Figure 4A. DNA analysis was used to determine the crystalline and amorphous nature of the drug and excipient for assessing the formulation stability. The XRD pattern, as shown in Figure 4B of the GQC, showed a mixed crystalline amorphous profile, whereas pure fluconazole displayed distinct crystalline peaks. After incorporation of fluconazole into the polymer matrix, the crystalline peaks were significantly reduced, indicating improved drug dispersion within the polymer systems. The thermal and physicochemical stability was also evaluated in this slide. DSA and TJ studies were used to observe the melting transitions and thermal stability. In Figure 5A, DSA thermograms shows changes in the melting behavior, confirming drug polymer compatibility. A reduction of drug melting peak indicated successful loading into the polymer matrix. In Figure 5B, TJ results demonstrate good thermal stability of the formulation, with the gradual weight loss corresponding to the polymer degradation. The physicochemical stability of formulation was evaluated using particle size analysis and the potential measurement, as demonstrated in Figure 5C and D. The optimized formulation showed suitable nanoproperties, with particle size of approximately 100 nanometer, enhancing absorption as well as permeation. A moderate zeta potential ensured good stability with minimal aggregation tendency, confirming the optimized physicochemical profile of the select formulation. Thus, this slide highlights the morphological characteristics and antifungal efficacy results. The same images as shown in figure 6a represents uniform surface morphology and the spherical structures of the nanoparticles. The results of the antifungal activity demonstrated a stronger zone of inhibition for the optimized formulation compared to the control, as represented in figure 5, 6b, and dc. Hence, the nanoparticles enhance the antifungal effectiveness of the fluconazole against the resistant Candida albicans strains. This figure represents the biological performance of the optimized formulation NGQ3 loaded with fluconazoles. The cell viability studies confirmed excellent cytocompatibility and safety of the carrier system as shown in figure 7a. The optimized formulation NGQ3 also exhibited enhanced mucoadhesion, resulting in prolonged gastrointestinal residence time, as shown in figure 7b. The permission studies showed improved drug transport across the biological membrane, resulting in improved drug absorption, as demonstrated in figure 7c. While the pharmacokinetic analysis demonstrated significantly higher bioavailability and sustained systemic exposure compared to the conventional fluconazole suspension, as represented in figure 7d. Conclusion. To conclude, 5 different formulations were developed by varying the concentration of polymer and cross-linker. Among them, the NGK3 optimized the optimized formulation NGK3 loaded with fluconazole demonstrated ideal nanoscale properties, physicochemical stability, and higher drug entrapment efficiencies. It also exhibited controlled release, enhanced mucoadhesion, strong antifungal activity, and higher bioavailability. Therefore, the quercetin gallium nanoparticles loaded with fluconazole is a promising controlled release system for the effective treatment of fluconazole resistant Candida albicans infection. Acknowledgement. The end, I would like to express my sincere gratitude to my supervisor, Dr. Ghulam Abbas, for his invaluable guidance, constant support, and encouragement throughout my research. Thank you. Jazakallah khair.